Hi, Dr. Yass here. I want to talk about the most important thing you get when you obtain a Yass Method Zoom session, and that is the proper diagnosis. And what is meant by the proper diagnosis is an understanding of what tissue is in distress, eliciting the symptoms you're experiencing. So if you're having pain, ultimately, the only way you're ever going to be able to address the symptom of pain is to understand what tissue is in distress, creating the symptom of pain you're experiencing. So there's lots of people out there suffering from pain and other symptoms, and there's lots of people promoting that they'll resolve your pain or they'll make you pain free. And they provide a treatment. But if you're going to subject yourself to that treatment without understanding what tissues in distress creating your symptoms, how do you have any understanding, or how do they have any understanding whether the treatment is going to address the appropriate tissue? You don't. You can only know that by getting the appropriate diagnosis. And the only way to get the proper diagnosis is through interpreting the symptoms you're experiencing. So beyond the pain, and when I say the pain, you have to understand all aspects of the pain. So what brings the pain on? What makes it go away? Tell me specifically exactly where the pain begins and where the pain ends. There's multitudes of things you must understand about the pain, as well as other corroborating types of symptoms. If you have pain in your lower back, is there some altered posture going on? Is the pain brought on by doing an activity? Is it made better when you stop an activity? There's lots of aspects that must be understood in terms of the symptoms the tissue in distress is eliciting. You have to appreciate the idea of why you're even having symptoms. Why does the body provide symptoms? And the answer is because once a tissue goes into distress, it is going to do everything in its power to create awareness, conscious awareness that it's in distress, because it wants an intervention provided to resolve the distress of the tissue. Once the distress is resolved, it doesn't have to elicit the emergency distress signal of pain or other symptom, so it ceases. So you have to understand that the symptoms you experience are there for a reason. The reason being that the tissue in distress eliciting those symptoms is trying to make you aware of which tissue it is. That's why it elicits the symptoms you experience. And every tissue creates a different symptom, right? So if you're having pain at your ankle, you don't say, oh my God, I think I'm having a heart attack, right? If you're having pain at your chest and your left arm, you'd think you're having a heart attack, right? If you're having pain in the lower back and difficulty urinating, you don't say, oh my God, I think I'm having a pneumonia. You say, oops, I may be having a kidney stone, right? So every tissue creates specific symptoms. That goes for muscle, bone, and nerve. Shockingly, each one creates specific symptoms. So this idea that, oh, you're having any form of global symptom, let's get an MRI, find a herniated disc and say it's coming from that, is insanity. It is the reason why chronic pain exists. Chronic pain only exists due to one reason. It says it above my head: misdiagnosis. You're treating the wrong tissue. The tissue in distress is still in distress, and therefore it is eliciting its emergency signal of distress to make you continue to try to find it so you can provide an intervention and resolve the distress of the tissue. Right? Does this make sense to you? It's got to make sense to you. So you can't start off any treatment unless you get the right diagnosis, meaning understanding what tissue is creating your symptom. Now, the spectacular news I have for you is that I've shown over almost 30 years that in more than 98% of cases, the cause is muscle. The literal tissue in distress eliciting your symptoms is a muscle or a group of muscles. Therefore, once you understand that and can understand which particular muscles they are, and understand how to strengthen those appropriate muscles so their force output is greater than the force requirement of your activities, which allows you to function without straining your muscles and the muscles creating symptoms, whether they're in the muscle, the joint, being referred by the muscle, or the muscle is straining and impinging on a nerve. It doesn't matter. Those are the four primary mechanisms by which muscle will create symptom. But ultimately, it's a muscle that has to be corrected. And I don't care if your pain's in your neck, your back, your shoulder, your ankle, your foot. It doesn't matter. From head to toe, more than 98% of cases, the cause of pain is muscle. But you will never know that unless you get the right diagnosis. The only way to get the right diagnosis is by interpreting the body's presentation of symptoms. The only way you're going to get that diagnosis by interpreting the body's presentation of symptoms is by getting a Yass Method Zoom session. You don't have to come to Jacksonville, Florida to get the Yass Method. You could just schedule a Yass Method Zoom session by going to my website, livewithoutpains.com, it's plural, livewithoutpains.com/sessions, and schedule your session. You can pick the day and time that's most comfortable for you. Doesn't matter where you are in the world. We're going to be able to do that session for you. We're going to make sure we get the right diagnosis. If it's muscle, I'm going to show you how to perform the exercise. You're going to do the exercise under my supervision. I'm going to make sure you understand how to progress resistance so that you understand how to strengthen the muscles to the point where their force output is greater than the force requirement of your activities, and you're going to end up pain-free and fully functional. The sessions are videotaped, so you don't have to worry. You're not memorizing anything. You don't have to have a high level of intelligence to be able to do the method. You're simply going to do that first session. We're going to videotape it. You're going to follow the videotape going forward to make sure you're doing what you need to achieve your goal. But again, you will never resolve your symptoms by trying treatments. You need to establish what tissue is in distress, creating your symptoms so you could treat the right tissue. The only way you're going to do that is through the interpretation of the body's presentation of symptoms. The only way you're going to get that is through the Yass Method, through a Yass Method Zoom session. If this makes sense to you and you want to talk to me about it before making an appointment, you can contact me by email at drmitch@mitchellyass.com. Or again, just go to my website, livewithoutpains.com/sessions, takes you to the page where you can make your appointment on your own. If you like this video, give it a thumbs up. If you like my YouTube channel, Dr. Mitchell Yass, please subscribe to get more videos, notifications when more videos are added or when I'm live on YouTube. This is your path, folks. The great news is that you don't have to travel to Jacksonville. I have been doing Zoom sessions before there was Zoom sessions, when we were only using Skype at the time. This is a very successful, effective mechanism to get the right diagnosis and the right treatment. For now, this is Dr. Mitchell Yass wishing you a pain-free, fully functional life. Bye-bye for now.